Full.
How many full? How many for full? Painful. How many for painless? So the majority is correct. It will be a painless. So it never causes pain. This is a painful decreased vision. Okay.
Sir, what are occlusions?
Occlusion.
Yes, sir.
Occlusion is blockage. Anything which is blocked is occlusion. You are occluded by your neighbors. So, arterial occlusions. Artery is not bringing the blood inside, so the retina will look white. And in this white, what we find is this. This is called cherry red spot. Another question which will be expected out of you is this. What is the cherry red spot? It's the white macula which is seen when the entire retina. And why this is not becoming white is only because of one reason. Macula is not supplied by central retinal artery. It is supplied by diffusion through the core. So the entire retina which was supplied by the central retinal artery will get white, but what tissue was not being supplied by the central retinal artery will appear vascularized. So this is central retinal artery, and this is a branch retinal artery occlusion, just like the venous occlusion. You take judgment. So if there is any reason where the nerve is getting compressed, that will lead to the swelling of the optic nerve head. This is optic nerve head, okay, what we find inside. This is called papilledema. So papilledema is the swelling of the optic nerve head, secondary to a central cause, that is the cause related to your brain. Painless or painful?
Painful.
Depends on the cause. If the cause is painful, you will have pain. If the cause is painless, you will have pain. Then there is pure inflammations of the retina, like the retina will start having white patches, and this is called retinitis. You have to treat the cause, why it is happening. Papilledema, there is no role of ophthalmologist except for the diagnosis that the nerve head is swollen, and it is swollen because of the central, so you send it to the concerned person. You find the reason here why retinitis is happening, and then you treat medically. You don't require surgery for this. So with this, we complete the introduction part of the ophthalmology. The second part of your lecture was what is blindness and refractive error. So how we assess the vision commonly, there are multiple modes, but the commonest in our country is this chart, which is called Snellen's acuity chart. So you see there is a large letter and then there are some small letters. The number which is written here is 60, it is here 36, it is here 24, 18, 12, 9 and 6. What it simply means is when we write the vision, we write it 6 by 60, 6 by 36, 6 by 24, 6 by 18. What it simply means is you are seeing something, the numerator part, the 6 part is what you are seeing. The denominator is what you should be seeing. So you are seeing from 6 meters the letter which should be seen at 60 meters. So when we write 6 by 60 is numerator is what you are seeing. 60 is what you should be seeing. So 6 by 60 is you should be seeing this letter from the 60 meter, but you are reading at 6 meters. And when you come to this, you write it as 6 by 6. You are seeing something at 6 meters, what should be seen as at 6 meters. So this is the best vision, and this is not so good vision. When we don't see light, it is PL negative. Perception of light is negative. Legal blindness, when a patient says that such and such person harmed me and I am not able to see. So that vision is vision in the better eye. Both eyes are involved. And social 3 by 60 to 1 by 60, vision in the better eye. Mind you, all these cannot earn and kind of the family will suffer. So this is called economic blindness. So vision in the better eye 6 by 60 to 3 by 60. Moderate visual impairment, थोड़ी सी रोशनी कम है. This is when the better eye is 6 by 18 or less. Individual from earning his wages, vision is less than 6 by 60 with the best correction. Mind you, ये भी unaided नहीं है, सबने चश्मा सब लगा दिया तब भी वो नहीं पढ़ पा रहा है. Legal blindness, the level of blindness which necessitates welfare measures and legal protection. Vision is 6 by 60 in the better and the best correction in visual field is less than 10 degree prorated. हमने देश में ब्लाइंडनेस कैसे कम कर दिया? हमने डेफिनेशन ही बदल दी. So the India has changed the definition of blindness. Now the inability of new definition which India has adopted from WHO is that is of 3 meters 3 by 60. So इससे हमने ब्लाइंडनेस कम कर ली देश में. 12 मिलियन से 8 मिलियन पे लिया है ब्लाइंड लोगों को. So ultimate goal is WHO goal, reduce the blindness prevalence to 0.3 by 2020. This year went into Corona. So national program for control of blindness, the name was converted again. Sure it is not the UP. National program for control of blindness and visual impairment. The NPCB program is now called as NPCBVI. Causes of visual impairment. The commonest cause still in our country is cataract, okay, followed by refractive errors, followed by glaucoma, and then AMD, corneal, diabetic, childhood trachoma, and XYZ. These two are the correctable measures. So what you need to understand is 57% patients suffer for no reason. They are correctable. They need to blindness. Different forms of blindness. Now this also comes